Hey there, this is Joe Bills here, your certified alcohol and substance abuse counselor. What is detox? This is the process of getting rid of toxins or drugs in the body while managing symptoms of withdrawal. Detox is usually the first step in drug treatment, followed by behavioral-based therapy or medication. Detox alone is not treatment. There are 4 categories of treatment, the first being detox: pharmacological treatment, which involves medication; residential treatment, usually with rehab, taking 6 to 12 months; outpatient treatment, which can take 3 to 4 months; addiction treatment goals. The aim is to help reduce an individual's use or stop drug use completely, to reduce the harm related to drug use, to achieve productivity in one's life. The importance of total addiction treatment. Addicts usually suffer from mental health, occupational health, medical problems, or social problems that make the addiction disorder difficult to treat. Addiction is a complex disease. For many, treatment is a long-term process that involves multiple interventions, and attempts at abstinence include relapses. Dopamine detox is a myth. It's fake. Dopamine cannot be detoxed. It's not the problem, but what can be fixed is the bad lifestyles. Dopamine is more like a byproduct hormone. Treatment doesn't need to be voluntary to be effective. Treatment is conducted with confidentiality unless where illegality or crimes come into play. So feel free to seek help, as professionals are private and confidential. Only sharing and communicating within the treatment team. Treatment duration. This can be predetermined, as each individual's progress through treatment is at different speeds. Drug addiction professionals include medical doctors, psychiatrists, psychologists, clinical officers, social workers, counselors, nurses, case managers, certified drug abuse counselors, and other substance abuse professionals. Why treatment is hard in Africa? Treatment is very expensive and requires long periods of time. Weak policies and the lack of Addiction Severity Index (ASI) research means there is limited data about the real drug problem, especially in third world nations. Thus, it's hard to formulate long-term or medium-term goals to tackle the drug problem. No treatment is appropriate for all. People with coexisting mental disorders should be treated in an integrated way. Detoxification is only the first stage of addiction treatment. It does little to change the long-term drug use. Possible drug use during treatment must be monitored continuously. Also, urinal tests must be done to monitor that drugs are not being used again. Treatment programs should provide assessment for HIV and other infectious diseases, as well as counseling to help clients change their behaviors. Recovery from addiction can be a long-term process and frequently requires multiple episodes of treatment. Example of a treatment plan. Problem statement: Zulu's alcohol abuse has reached alarming levels and his wife plans to ditch him. Goal statement: Zulu will reduce alcohol use to help save his marriage. Treatment objectives: 1. Receives alcohol treatment. 2. Reconciles with his spouse. 3. Manages his triggers. Interventions: the staff will provide counseling-based therapy to help Zulu to overcome alcohol craving. The staff will teach Zulu drug refusal skills. The staff will discuss Zulu's treatment with his wife. Functional analysis. Like I earlier stated, addiction is a complex and complicated disease which is difficult to treat, to understand fully, and requires medication or CBT. To be effective, formulate antidotes for the addiction client. Strategic plans are customized according to the patient's needs, and this requires functional analysis for successful treatment. During treatment, withdrawal symptoms may pose a challenge. If relapse occurs, then modification and re-engagement of the functional analysis plan is vital. Relapse is common in many cases and does not mean failure of the plan. Relapse can be frustrating to both the family, friends, or counselors. A positive approach always helps, and success cases prove that it is worth trying again. I hope you enjoyed this topic, which is not usually discussed. Watch my videos on frequently asked questions and myths on drugs by teens. Remember to like, comment, and subscribe to the channel. Thanks for watching.